Today I'm talking nasolabial folds, smile lines, and accordion lines. And I'm also going to pop down to Beverly Hills. We're going to hear from a couple of plastic surgeons. Number one, Dr. Ben Talei, and number two, Dr. Kian Karimi. We all have different approaches. I want you to get an idea what some of the elite Beverly Hills surgeons do for nasolabial folds and for celebrity transformations.
Let's also look at some great before and afters to give you an even better idea of what you can expect and how to navigate this.
I'm on my way to the airport, but I wanted to get this video off before I left because it's so important. I saw 7 patients in clinic this week, 4 of which had to dissolve some product that they had put in for their smile lines. So for the purpose of this video, let's talk about nasolabial folds. Let's call this the smile line. A little more detail on that in a moment because many of you that might be a little new concept to think of it that way. And then accordion lines. So when we smile, we get these lines at kind of the side of the cheek from loose skin and collagen. They're 3 very different things. So what are the products I'm talking about today? Skincare, things you can do at home, injectables, biostimulators, fillers. Let's start. And the patients that I saw in clinic, the problem was that they had filler or diluted filler placed for their smile lines because they thought that that was an aging feature. But then what happens is we add volume to the lower face. So Dr. Ben Talei is going to tell us a little bit about it.
Volumetrically, you can add with fillers, and you can put fillers either into the nasolabial fold to blunt it just a little bit or above it. It's always better to put above if there's space above. Now, you don't want to overfill the face.
Did you hear what he said? Don't overfill.
Just gentle amounts. You can do filler and then radio frequency.
Let's come back to Dr. Talei, but overfilling of the lower face, not what we want to do in general. I want to go into detail with that for you. I did just have mine addressed. I was in a training and the student's model didn't show up. So I said, okay, I'm going to take you through exactly what I had done. I hadn't done anything there in maybe 7 years. So I want to tell you exactly the method that I did it because what's important to understand here, when we talk about nasolabial folds, the maxilla or the top bone, you have a mandible below, a maxilla here, the bony changes create an odd angle, an aging angle, a new angle for you. And that's part of the reason where people go wrong by just filling the nasolabial fold. Okay, let's hear from Dr. Ben Talei. He's a Beverly Hills plastic surgeon, treats my friends and celebrity friends, and many of you already know him. I had the pleasure of sitting in on a lecture of his in Beverly Hills. He thinks of the face very differently. When you talk to him for about 10 minutes, you get 10 different ideas on the face. And he's very vertically oriented in his facelifts, so they look natural. But let's see what he has to say about the nasolabial folds.
This is Dr. Ben Talei out here in Beverly Hills talking about nasolabial folds, which is the bane of everyone's existence. These folds right over here, most of the time are poorly understood, and there's so many treatments that vary all across the place because the causes of why you're seeing the folds vary from person to person. So I'll just go over the quick do's and do nots and why this even happens. So the nasolabial fold is a junction between your cheek and your upper lip that tends to form on people over time with either a little descent of the face or deflation. It is not, I'll tell you what it is not. It is not a fold that occurs like a belly fold. So it's not a belly fold that's there that needs to be like liposuctioned or taken down or removed or anything like that. Why it happens is because you end up with a concavity in a certain area that comes and folds around and forms a shadow. This could happen from mid-face collapse in terms of volume loss. It could occur because of descent, and it can also occur because of volume loss within the nasolabial fold itself or below. And the only way to know is to feel it. So you can feel it and see if there's good volumetric support underneath, and that'll help determine what to do. So the options are, number one, biggest option, facelifting. You can always do a mid-face lift in the deep plane, and that'll roll those tissues back up. If you add volumetric support, meaning fat grafting to it above it, It's going to give tremendous change in shadowing, contour, and improve it on the majority of people. This may not cut it on everybody, so sometimes you need to do radio frequency treatments. Radio frequency treatments, you have the ones that try to melt fat. I don't advise doing those. The ones that tighten the skin overall are a better move, and they treat it more appropriately.
The other factor, there's a nasolabial fat pad, and I find that men get this much more. And you'll see a hanging over fat pad here just below the medial cheek. And that's why I'm addressing more and more nasolabial folds, because most of us are attuned to addressing the upper face first to get that lift. The third point about this is 50% of you and 50% of the patients that walk into my clinic, I say no, because a nasolabial fold is a very natural thing. Okay, Dr. Talei, what should you not do for nasolabial folds in your opinion, or where you see problems?
What not to do. Big no's. Don't try to cut out your nasolabial fold. Another big no, don't put an implant in your nasolabial fold. Another big no, don't go dumping tons of filler down onto the bone there into a risky area. There are other ways to do it that are a little bit safer.
What's your thought on RF and radius, and what are some key final points from you before we go on to Dr. Karimi?
So profound radio frequency, matrix, Morpheus, those are the ones you'd want to use that can add on to it. Volumetrically, you can add with fillers, and you can put fillers either into the nasolabial fold to blunt it just a little bit. Another big no, don't go putting radius in the soft tissues over there. They tend to crystallize, and they can actually affect your smile function. And this happens all the time when people dump it into the nasolabial fold, because the smiling muscles, the levators that pick it up, and the orbicularis muscle that comes across, they start to struggle when they smile, move, and lift. So these are the various options. There are other options. The key here to understand is that nasolabial folds are not meant to go away. You're supposed to have them as a human being. We just try to make them lighter when they get darker, and that's it.
So people come in, they want it filled, and I say, it's not aging you. It looks very natural. And potentially for some people, if you fill it, you're going to look odd. But it's a focal point like the nose is. Nose, everyone just, okay, it's number one, number two surgery in Hollywood, along with the upper left, the upper eyelid, because people are focused on the nose. It's also the highest dissatisfaction procedure, meaning people focus on things that no one else sees, and it's minutia. The same goes for the nasolabial fold. Okay, let's hear from Dr. Kian Karimi, Beverly Hills, board-certified facial plastic surgeon. He treats many celebrities. He's well known for his nose surgeries and rhinoplasties. He's treated my friends and celebrity friends. He's a rock star, speaks many languages. But let's hear what he has to say about the nasolabial folds, what to do, but also maybe what not to do.
Dr. Kian here. Let's talk nasolabial folds for the younger patient who doesn't need a facelift. This is where the thread lift is really effective. Threads can help lift the nasolabial folds without any surgery, any downtime, and can last 1 to 2 years. But you have to be the right candidate for it.
So here's a nice result from a thread lift, probably about 12 barbed or lifting molded threads done. And you can see where the nasolabial fold is softened, as well as that mid face, and the tissues are just reopposed so that there's fullness in the mid face to help lift the nasolabial fold. Okay, Dr. Karimi, number one, what's your number one treatment if people can do surgery?
As a facial plastic surgeon, my preferred way to lift nasolabial folds is through a deep plane face and neck lift. For the older patient with a lot of sag, this is the most effective solution that will last 10 to 20 years.
Here's the results of a facelift, and you can see facelifts really shine in the lower face. That's the hardest for us to address with fillers because we don't want to make it larger. Look at the fold underneath the neck. That bothers a lot of people. And then look at the edge of the mouth. Melolabial fold, or the oral commissure, or that downturned mouth, when we remove that, that just defines the jawline. So that's a facelift result. So what do you do if it's appropriate to fill the nasolabial fold? As an aside, when getting lip filler, I almost always address the piriform aperture, that where that bone loss was, because the profile is so important. If you go into your injector for anything, but particularly the nasolabial fold or the lips, and they fill you without getting you to move, looking at you in a dynamic way, you're going to get botched, a bad treatment, or you're with an inexperienced injector. So those are some things to look for. So let's talk nasolabial folds. Let's say you are appropriate. You're one of the 50%. The way to do this is to address the bone first and to inject that piriform aperture. So that brings the whole complex forward. It also helps hide the nasolabial fat pad, and also the mid face or the mid cheek needs to be addressed along with the temple if this is really deep, because we're looking for lift. What's going to give you lift? Not filler. What will give you lift? Biostimulators. What am I talking about? Well, we have Sculptra. 90% of the world, they want all natural. So you have plasma fill, PRF, platelet-rich fibrin from your blood draw. You have Radius. So for many of us as a biostimulator, we're going to talk about hyper-diluted or Radius that's diluted with saline, with a liquid, because that's going to give us the calcium hydroxylapatite in small form with a lot more liquid, just like Sculptra goes in as a water, not full filling Radius. That can be a little bit much. So you got to address the bone, and then you address the smile line. And you're better off doing it in 2 stages. I want you to think patience, meaning I want not patient, but patience, like timeline. I want you to be patient with this, because I'd much rather you go to your injector twice and get it the right way than get it overfilled. You're going to be unhappy, and it can migrate where you don't want it, into the nasolabial fat pad. So that's what we're going to call nasolabial folds. Now the smile line, which this depends on bone structure, also a bit of fat loss. We see it more in thin females typically, and that is lateral to the nasolabial fold, often only present when you smile. This is the dangerous one. And again, biostimulators are going to be much more natural looking here. You don't want to add bulk to the lower face, and this can be a very natural look. So if you're 40 and you're seeing this, and you look back at a picture of when you're 20, you would see a hint of that. Almost always. So all you want to do is take the edge off that. You cannot fully reverse it if it was part of your facial structure at a younger age. Accordion lines, that's laterally. Now you have options. So there's skincare you can use, which is the #1 way to do it. Alpha hydroxys, retinaldehydes, chemical peels, and by chemical peels you can get wipes that have retinol in them or alpha hydroxys. They all build collagen. What you're trying to do is build collagen, not volume. Okay, so that's skincare. You can plump it up with hyaluronic acid and argireline, and that will help decrease some of the movement right at the line. Wonderful. Chemical peels can work. Fractionated RF. Here I'm using the RF microneedling device for a V-line transformation, but it's the same one I use in older people that get smile lines because I'm not going to add volume. There can be some pain involved, but I add lidocaine, and there's other measures to help with the pain because you do have to get appropriate levels. If you don't, you're just not going to get the results. And of course, there are side effects like hyperpigmentation, so you have to see an expert for results, so you're running that fine line. You have many options out here, but people like injectables. I like injectables. Hyper dilute Sculptra. Hyper dilute Radius. Why the triple hyper? Because you don't want to add volume. Not filler. And that's what I was dissolving on these patients that had come in and had filler, and they looked unusual. It might look good for the first 3, 4, 8, 9, 10 months. Filler lasts many, many years, 5, 10, 15 years. It migrates, it starts to draw water, and it looks boggy. Probably does something to your SMAS level too. So that would be the accordion lines. I want to know. If you want to see more and hear more from my colleagues, just let me know. I'll bring them on for a full webinar. Have you had them filled? You're now going to want to watch this video on my blueprint basic skincare routine to prevent all this and help reverse it.